Hello to everyone. I'm Jessica Goldstein, Education Program Coordinator for ASRM. Welcome to this webinar on mind-body strategies to decrease stress during the COVID-19 pandemic, how ASRM members can learn to improve their own emotional and physical health. Please join me in welcoming my colleague, Dr. Jeffrey Hayes, and today's panelists, Drs. Elizabeth Grill and Ali Domar. Alice, or Ali Domar, is a health psychologist who focuses on the application of mind-body medicine to women's health issues. Her research focuses on the relationship between stress and infertility, with a focus on the impact of cognitive behavioral interventions, as well as access to care and patient retention. She is also a practicing psychologist and does individual, couples, and group therapy. She is the executive director of the Domar Centers for Mind-Body Health, the director of integrative care at Boston IVF, and an associate professor of obstetrics, gynecology, and reproductive biology part-time at Harvard Medical School. She is past chair of the Mental Health Professional Group of ASRM. Dr. Grill is an experienced counseling psychologist, medical researcher, lecturer, and writer with a special focus on sexual health, the emotional aspects of infertility, IVF treatment, third-party reproduction, oncofertility, and fertility preservation. Dr. Grill is secretary for Resolve and served as chair of the Mental Health Professionals Group of the American Society for Reproductive Medicine. She is currently serving as Director of Psychological Services at the Ronald O. Perelman and Claudia Cohen Center for Reproductive Medicine, and Associate Professor of Psychology in the Departments of Obstetrics and Gynecology, Reproductive Medicine, and Psychiatry at Weill Medical College of Cornell University. Before we begin, please note that all attendees will be muted except for the presenters. Time at the end of the presentation will be reserved for questions. Please type a question in the question chat window at any time. We'll read as many selected questions as possible to the presenters during the allotted question and answer time. A recording of this webinar will be archived on the ASRM website in the coming week. Please watch your email for notification. And with that, let's begin.
Thanks, Jessica. This is Ali Domar. And
hi, this is Liz Grill calling. So glad you could join us.
So we do not, Dr. Grill and I do not have any financial interest in any of the content included in this presentation.
So we're going to talk about stress for a lot of this presentation. And for the purpose of this presentation, we're going to define stress as the consequence of not having adequate resources to meet the demands in one's life. And those resources could be lots of things. It could be money, time, health, social support. And I'll just note that, healthcare providers, we are all used to a tremendous amount of stress. And I think the one thing we may not be as used to is understanding the triggers of our stress and then how to do things to help with that stress. So hopefully this presentation will address both of those things.
So many ASR members, Liz and I have been talking to a lot of ASR members over the last few weeks, and many people have had their hours cut, they've been laid off, they've been furloughed, they've had some kind of financial impact from the pandemic. A lot of clinics, in fact, probably most clinics in the U.S. have had significantly lower revenues. And thus, the healthcare professionals who are still working may have significantly higher patient loads. I know that I personally, for the last 6 weeks, have been seeing exactly double the number of patients that I was seeing before the pandemic. And all of us are worried about our health because, as healthcare professionals, we are used to taking care of our patients. And, we've probably learned over the years to take care of ourselves at the same time, but I don't think anything has prepared us for the impact of a pandemic, both on our patients and on ourselves. And our traditional avenues of social support may have disappeared or changed. I mean, if we're not going to work, we're not hanging with our coworkers. We can't, go out for drinks after work. We can't go for walks with friends easily. We can't socialize. We can't go to restaurants. And, there's so much data over the last couple decades showing that social support is vital for our mental and physical health. And a lot of our social support has either changed or disappeared. And many of us feel a lot of uncertainty about the future.
And so a lot of what Ali was just referring to can lead to things called burnout and compassion fatigue, with healthcare providers. So it can be challenging just to handle fertility patients on any kind of quote unquote normal day, given the demand that they can place on our staff and our offices. But you add a pandemic to this, as well as closures of some of the clinics and postponement of cycles. And it's really a recipe for disaster in terms of the stress levels going up for our patients, which then impact all of us who are treating the patients. So we just want to be mindful in ourselves and in our colleagues of signs of burnout and compassion fatigue, because those two things can really affect our ability to work, and most importantly, our ability to remain empathically connected to our patients. So especially when they are overwhelmed by personal feelings and a world crisis, it has a huge impact on both them and ourselves.
So how do you know if you're stressed? You know, symptoms of stress can be physical, they can be psychological, they can be behavioral. I can't tell you how many patients I've seen in my career where people will come in and say, well, I'm not stressed. I'm fine. I'm not stressed. And I guess what we want to talk about is, do you have a sense of your own stress-related symptoms? Do you have a sense? What signals does your body send out when you're under stress? I'm always telling people that our minds and our bodies are not subtle. Like when we're stressed, signals are sent out. And these signals, as I said, can be physical, psychological, or behavioral. And so I want you to think about, in the past, how did you know you were stressed? What signals did your body send out? And in fact, did you have some physical, behavioral, or psychological symptoms that you didn't think were stress-related, which actually could have been? And have you noticed any new stress-related symptoms over the past 2 months?
So a lot of the ways that these stressful symptoms and signals are delivered to us are in the signs of physical symptoms. Sometimes we are not picking up on our stress until we have a migraine headache, or we notice that our sleep patterns have changed, or maybe you notice that all of a sudden you have a kink in your neck or something in your back that's hurting you. It could be fatigue, just feeling exhausted all the time, even if you're getting enough sleep, but you never really quite feel that rested. A lot of times it's gastrointestinal symptoms. So we have a lot of kind of irritable bowel syndrome, nausea, bloating, abdominal pain, shortness of breath, can lead to panic attacks even sometimes. So noticing a change in the way you're breathing. Some people even start to hold their breath if they're feeling really, really stressed out. It can affect menstrual cycles. So these are some of the physical symptoms you really want to pay attention to. And if you notice that you're having any of these, it probably means that your stress levels are getting a bit too high.
So, what are your psychological symptoms? You might be feeling fine. You might be sleeping fine. You may have, a normal gastrointestinal symptoms, no symptoms. You might, most of us, I think, are probably eating a little bit more because we're at home so much of the time. But symptoms of stress are not just physical. They can also be psychological. And some of the most common symptoms, and again, you need to sort of reach deep within yourself and maybe ask people around you, if you don't recognize these in yourself, are you more irritable? The things that normally not have bothered you, do they drive you crazy? Does your dog drive you crazy? Does your partner drive you crazy? Are you more irritable? Worry, I doubt there's anybody out there right now, probably in the world, who's not worrying more than they were a few months ago. I think that it's scary. And I was talking to a patient of mine this morning about this, and I said, it's scary. This feels like we're living in a movie, and no one or nothing or no training could have prepared any of us, especially those of us who are healthcare professionals who feel like we have our training, we know what to do, we feel in control. Yeah, you might be worried a lot of the time, and we may be feeling sad. There might be a family wedding that got postponed, or a trip that you were looking forward to, or, a special dinner at an anniversary dinner, or having your kids come home, or anything. I mean, there's a lot of sadness right now because most of the things that we've been looking forward to for days, weeks, months, years have been either canceled or postponed. And it's normal to feel sad. We tend to feel sad when we feel out of control. And right now, most people during the pandemic are feeling out of control. It also is very common to feel hopeless. I mean, honestly and truly, if you pick up a newspaper or look at the news online, it's hard not to feel hopeless. And we'll talk later that this is probably a good time to decrease your access to news. It's easy to be confused. I mean, a lot of emotional Angst tends to make it really hard for us to think clearly. We tend to not really understand what we're hearing. We forget things. This is a time where people are forgetting their keys, and they're forgetting. I mean, I have so many patients now who I'm seeing patients via Zoom, and they forget to log on. And we're easily angered. It sort of goes hand in hand with irritability. Your life has changed. Human beings tend to not do so well with change. And pretty much every aspect of most people's lives has changed. And that tends to make us feel angry and out of control.
So there's some gender differences in how people relate to stress and how that translates into some behavioral changes that we'll see. I wish we could have a discussion about this, and I can ask you all to sort of guess what you think the answer would be to this, but we don't have the luxury of that. So I will just ask you, what do you think of the top 2 behavioral changes in men first, and then we'll talk a little bit about women.
So men, and I have to actually tell you that most of these slides came from my younger daughter did it, and I was sort of concerned that she was the one that came up with this rather than a picture of a nice man just watching TV. So men, when they are stressed, tend to watch more television and drink more alcohol. Those feel very natural. In fact, I think alcohol sales in the U.S. are up 400% right now. And I believe I've read recently that cable downloads have also increased significantly. So the men in the U.S. are doing what they do when they're stressed. They're watching more TV and they're drinking more alcohol. What about women? I want you to think about this. Do men and women differ? Do women also watch more TV and drink more alcohol? I'll just give you a hint. Women's top 2 habits are different. And none of the 4, 2 for women, 2 for men, benefit you in any way. So let's show what women do.
So women tend to exercise less and eat more junk food. That picture is making me hungry. Sweet and salty tend to be comfort food. Although, I will say, of course, there are differences. A lot of this is based on what the research showing and gender stereotypes, but I have plenty of patients that are also exercising excessively, which can be just as unhealthy in some cases. And I have a lot of people who are eating less because the anxiety is making them nauseous, and so they're pulling off of food. So just being sensitive to differences, and this will vary.
So I have to say that Liz clearly knows me really well, because she just sent me, I just started a birthday basket of brownies and peanut bars and cinnamon squares and stuff. But I can tell you, in this household, it's definitely the sweet. So what are other symptoms of stress? I mean, maybe if you're a guy, you don't drink more alcohol or watch more TV. And then maybe if you're a woman, as Liz said, maybe you're exercising more and eating less. So are there other behavioral symptoms of stress? Yeah. Chewing gum is a very common. It actually helps you eat less, but gum chewing is a way to demonstrate stress. Watching more TV, just in general. Alcohol or drug abuse for either gender. For either gender, increased consumption of sweet or salty food. Decreased exercise. Lethargy. I can't tell you how many people I've talked to in the last month who just feel sluggish. It's just really hard to get out of bed. I spent the first 2 weeks, I'd say, of the pandemic telling every one of my patients, okay, you need to get up at the same time every day. You need to take a shower. You need to get dressed. You need to have breakfast. Because, I'm sure this happened to Liz too. I can't tell you how many patients that I would do Zoom sessions with them, and they clearly didn't realize that I could see them, because I would be doing noon Zoom sessions and they looked like they had just rolled out of bed. They were in pajamas and their hair wasn't brushed. And these are all symptoms that we're just really stressed.
Full disclosure, Allie, I look like that on most days before 12 too. But anyway, moving on. So we're going to go over some physical strategies and some psychological strategies to decrease stress. We're going to start with some of the physical strategies now that hopefully you've gotten in touch with what your own behavioral habits are and what your triggers and signs of stress are. We're going to tell you how you can help with some of this. So the physical strategies that we'll go over in some detail are relaxation techniques, mini relaxation techniques, exercise, what do we do about nutrition so we're not just eating comfort food all the time, and how do we set boundaries with people.
And the psychological strategies, since Liz and I are 2 psychologists, are cognitive restructuring, which means challenging automatic negative thought patterns, emotional expression, which means what do we do with all these negative emotions that are churning inside of us, Social support. I mean, how can we get social support during a pandemic? And I think probably the most important of all is self-nurturance. Like, how can we care for ourselves? We are all healthcare professionals. We are so good at taking care of other people. Well, now's the time to start to figure out how to care for yourself in a more effective way.
So here's a list of relaxation techniques. There are so many that we could go over. These are some of the more traditional ones. You can find these on most of your relaxation apps. So they're very easy to find and very easy to start doing. The most important thing is that you just find a technique that works for you, that's comfortable for you, and know that not every technique will work every time. So we want you to build sort of a toolkit of techniques throughout this presentation that you can draw upon when needed. The most important thing to realize about relaxation techniques is that they interrupt fight or flight. So fight or flight happens on its own when we feel stressed, when we feel threatened, and the only way to really counteract the fight or flight response is to elicit the relaxation response. And so most of the things we're now going to go over are things you can do to counteract that fight or flight response.
So before I go on, I just want to remind people that probably the last 15 or 20 minutes of this webinar, Liz and I will be taking questions, and there's a little box on the right of your screen. So if you think of any questions, start jotting them down now, and so that we can address them at the end of the webinar. So mini relaxation techniques, I think, are some of the most effective things I teach anybody, and especially good because you take your lungs everywhere you go. So no matter where you are, no matter what the situation you're in, you can do a mini relaxation, and no one needs to know you're doing them. And it's simply based on diaphragmatic breathing. And you all know the diaphragm is this massive muscle which separates your chest cavity from your abdominal cavity. And to breathe diaphragmatically, it's almost like a sigh. So it's, and when you breathe in such a way, your diaphragm drops down as you inhale. It allows your lungs to more fully expand with air, and it just leads to a sense of relaxation. It also brings down your heart rate and blood pressure. So, as I said, you can do a mini eyes open or eyes closed. If you're driving, it's probably better to do it eyes open. And the idea is there are 3 different ways that I will teach you how to do a mini, but there are probably lots of different ways to do mini. It's simply a matter of switching over to diaphragmatic breathing. If you're struggling to try it right now, the easiest way to do it is to try breathing in through your nose and out through your mouth. And if that's still a problem, just sigh. Get a sense of how your chest will rise about an inch as you inhale, but so will your abdomen. And if you're still struggling, just lie down on a bed tonight and put your hand halfway between your belly button and your rib cage, and you'll actually realize when you breathe diaphragmatically, your chest and abdomen rise about an inch as you inhale and fall about an inch as you exhale. So the first way to do a mini is probably the most popular, is simply count down from 10 down to 0, one number for each breath. So if you switch over to diaphragmatic breathing, and you say to yourself 10 as you inhale, and then exhale. The next breath you say to yourself 9, exhale. And count down right now from 10 down to 0, one number for each breath. Hopefully by now you're finding yourself, as you do the diaphragmatic breathing, you feel a little bit more relaxed and less anxious. Some people, including myself, have the ability to worry and count at the same time. And so mini number 2 is actually a little more focused. So as you inhale, you count up to 4. And as you exhale, you count back down to 0. So as you inhale, you go 1, 2, 3, 4. And as you exhale, you go 4, 3, 2, 1. And I usually advise my patients to do 3 or 4 of those, and they can feel the differences immediately. And then finally, probably the easiest way to do a mini is to slowly breathe in, hold it for a count of 3, exhale, count it, hold it for a count of 3. And again, you do 3 or 4 of those, and it's just amazing how much better you can feel.
So one question we get is like, so when do I do a mini? I tell people that minis should really become the default way that you breathe throughout the day. They should become so automatic that you just naturally know that that's where you go to cope when you feel anxiety. So one of the first things you can think of is tuning in to what we just talked about in terms of psychological stress and physical symptoms of stress. And just get to know your body a bit more. Do you become irritable? Do you get a stomachache? Do you get a backache? Do you become forgetful? And those are the perfect times, once you're aware of those things, to tune into doing any form of the 3 minis that Allie just taught. So if you're feeling jittery, if your palms are sweaty, you'll notice that this really starts to take you back down to a baseline that feels more comfortable for you psychologically and physically. The other way to do minis is to just start identifying situations that you know cause stress and do them in anticipation of that stress. So if you're going out to the grocery store for the first time because you've been getting deliveries lately, if you are starting to see patients and going back to your office, I know a lot of people are feeling stressed about taking public transportation back into their offices. So any time that you're anticipating that stress being an issue, you want to default back into doing a mini.
So another question which everybody's asking these days is about nutrition. You know, I've been joking for months that instead of gaining the freshman 15, we're all going to gain the COVID-19. I actually do have one patient who's already gained 10 pounds. And so this is probably a really good time to talk about nutrition and stress, because when most people are stressed, they tend to eat more junk food. They just, you know, as I was talking to a patient of mine this morning, and she said, you know, when she's at work, there's actually no kitchen at work. And so at lunchtime, she has to go out and get herself a meal and make an effort. She says now she's at home and her kitchen is, you know, 6 feet away, and there's lots of food in the fridge and the freezer and in the cabinets. And so she's found herself eating a lot more, and she's just not comfortable with herself. So I would say the same thing, you know, for pandemic eating as I would say for any other kind of eating. This is the kind of nutrition we've been teaching our patients for a very long time. There are no bad foods, you know, unless you have some kind of health issue. I mean, obviously, if you have celiac disease, eating a piece of bread that's not gluten-free is a bad food for you. But in general, there are no bad foods. And so what we teach our patients is to aim for an 80-20 balance. So if 80% of the food that you're eating is the good stuff, so it's the Greek yogurt with fruit, and it's the salads with a small amount of dressing and the salmon on top, or it's the apples for snack, it's the dinner of, you know, grilled fish and vegetables and brown rice. And, you know, if you're eating that way 80% of the time, if you're eating the good stuff 80% of the time, the other 20% can be more like the stuff you crave. And, you know, all you've been seeing these days is recipes for mashed potatoes and meatloaf, and, you know, all these ice cream stands are opening, and, you know, it's so easy to, or so hard to go, if you go to the grocery store, not to grab the bag of chips. So there's a lot of comfort food out there that we instinctively want, crave, reach out for. And that comfort food is fine as long as that's your 20%. So if you've been eating really well all day, and so for example, for me, I've eaten well all day today, and Liz just sent me this birthday basket of goodies, that goodie will be my 20%. And so it's guilt-free. And the reason this works is that what people tend to do is they tend to deprive themselves most of the time. And so they eat the Greek yogurt and the salad and all that stuff, and they do this for 2, 3, 4 days in a row. And then they are in some situation where there is food. So they go to a meeting, they're chocolate chip cookies, or they realize there's a pint of Ben and Jerry's in the freezer, and then they, what we call the what the hell effect. So you eat the cookie, and then you're like, oh, what the hell, I've eaten the cookie, I might as well wash it down with a Ben and Jerry's. And this happens a lot in work situations where people are being super careful, and then they eat something that they consider to be a forbidden food, and then they go crazy the rest of the day. So what we're saying to you is the best way to reduce stress when it comes to nutrition is to make 80% the good stuff, and then the other 20% can be guilt-free, the stuff that you may want, like the meatloaf.
So we always have to include self-protective boundaries when we talk about, going through crises, because we're drawn to help people. That's why we're all in the healthcare profession. And so our inclination is going to be to help all those around us, not just our patients, but our friends and family who probably are relying on you for a lot of the answers and think that you have all the answers right now. And so it's really important to just be very cognizant of when you're being overextended. When you're overextending yourself, probably it's going to trigger all these stress responses we've been talking about. So as good as it may feel for you to help others, it's really important that you maintain solid boundaries as well and draw a protective zone around yourself and try to choose the things that make you feel good and relieve stress rather than the things that wind up becoming an emotional burden.
So let's talk about exercise. And, I literally keep a pair of sneakers in my office, and relatively frequently I haul patients out for a walk, and we actually do therapy while we walk. And the reason for that is, as many of you know, I'm not all that comfortable with a lot of my patients being on antidepressant medications. I mean, it's obviously appropriate and relevant for some of our patients, but it's pretty astonishing how many of our patients are taking antidepressant medications. And these are patients who have never exercised regularly. And so I want to take them for a walk just so they can get a sense of how it feels to exercise. Exercise really is as effective a treatment as depression as is exercise. It's associated. I mean, if we could come up with a pill that would do what exercise does, it would decrease the risk of heart disease, cancer of the breast, colon, and bladder. It improves immune function. As I said, it treats anxiety and depression, and it's free. So if we could come up with a pill that did all that, I'd be richer than Jeff Bezos or Bill Gates. But that's simply what walking can do for you. And I definitely have seen people walking far more during the pandemic. But if you can find a half an hour a day to just get out there and start walking, you're going to find your stress levels significantly coming down.
Yeah, so I tell people about exercise the same thing I tell them about relaxation, that there's no wrong way to do it except not to do it at all. So it's just important that we encourage ourselves and our patients to just exercise for some amount of time every day. Every day, a little bit is better than longer periods on one day, and of course, not doing it at all. Just getting blood flow, getting our muscles moving, it just helps with depression and anxiety and all these other stress symptoms and signals that we've been talking about. Being inside right now is so difficult. So while there is access to lots of different Zoom videos, and it is a great way to try that yoga class or that Pilates class that you've been wanting to try and haven't been able to get to the gym to do, it is a great thing to be able to do, to try some of these online classes. But as Ali was saying, getting outside and soaking up that vitamin D is really important right now. So if you're in a place that you feel safe to do that, or safe to do it with a mask, with social distancing and physical distancing, we really recommend getting outside, especially as the weather's getting nicer. It's really important.
So now let's get to the psychological. So what causes so much stress? Is it simply what's actually going on around us, or is it what our mind is doing to that information? And the fact is, you need to start looking at your brain as a tape recorder. And I actually see adolescents, and I saw an adolescent recently, and I was talking about how to challenge automatic negative thoughts. And I said, think of your brain as being like a tape recorder. And she said, what's a tape recorder? Which made me very sad. But I'm like, oh man, I'm so old. Anyway, so if you think of your brain as being, I'm assuming all of you know what a tape recorder is. If you think of your brain as being like a tape recorder, and you think of the tapes that play over and over and over again in our heads, the vast majority of those tapes are negative. So if you wake up in the morning and you take a shower and you stand naked in front of the mirror, is your first thought, sheer perfection? No, we tend to look at ourselves naked in the mirror and go, oh my God, what happened? But the fact is, a lot of our negative thoughts are just not true. And our negative thoughts come from lots and lots of different places. And so what we do with our patients is we help them challenge and restructure these automatic negative thoughts. You in effect try to erase what the old tapes were, and you put in accurate thoughts. They don't have to be positive, they can simply be neutral, but the point is they need to be true. So the first question is, does this thought contribute to your stress? And obviously if someone's bringing it to us, of course it contributes to their stress. The second one is, where did you learn this thought? And this is something that all of us need to think about, because we tend to have these tapes that play over and over again in our heads. And because they've been playing for so long, we just assume they're true. But you need to stop yourself and go, where did I learn this? And basically, half of these tapes tend to come from something someone said to us a long time ago, like you're lazy, or you're not as smart as your brother, or you're fat, or you won't accomplish anything, or you're going to be a terrible mother, any of the things that people end up hearing over their lifetime. So a bunch of thoughts, these negative thoughts, come from something someone said to us a long time ago. And then a lot of the thoughts come from our fear speaking. So for our patients, a negative thought almost always is, I'm never going to have a baby. And what I say to my patients is, if you knew you weren't going to have a baby, you wouldn't be putting yourself through treatment. So it's their fear speaking. So you really want to think about where you learn this thought. And then you need to ask yourself, is this a logical thought? Does this thought make sense? Or is it just sort of my own warped mind? And finally, is this thought true? For the vast majority of these negative thoughts that we have, you're going to find that answers 3 and 4 are no. Now, some of them are true. Like, if someone has a negative thought that says we're in the middle of a pandemic, yeah, that's actually true. Or, if I have a negative thought that says I'll never be a natural blonde, well, that's true too. But if I have a negative thought that says I won't be happy because I'm not a natural blonde, that's something that you can restructure. So you want to look at these thoughts, and if the thought is not rational and not true, the idea is to restructure it. So our patients can start with, I'm never going to have a baby, and end up with, I'm doing everything I can to get pregnant. And, that's not like, I'll be pregnant tomorrow, but it's a rational and true statement. And for any of us, all you need to do is to stop torturing yourself mentally, is to come up with rational and true statements.
So the way you can start doing this for yourself is to really start thinking and tracking what your automatic thoughts are. They're called automatic because they just pop into your head. It could even be an image, or it could be an associated feeling that you get. So really start to think about what some of those automatic thoughts are that are in your life. You can think about the last situation that you were in that caused you a tremendous amount of stress or anxiety or frustration or pain or sadness. And then really think, what was I thinking right before that? So that you can begin to challenge them with some of the questions that Ali was just referring to in the previous slide. So the way you want to challenge them is to start with what the thought is. It could be, my job in life will never go back to normal again. And again, you don't have to just flip that to a positive thought. That's not really what this exercise is about. It's really to start to think about, is there evidence that supports this thought? Is there evidence that doesn't support this thought? And then sort of combine the two to come up with something that's a little bit more balanced. So maybe it looks like, my life will not be disrupted forever. I am resilient. I have survived crises before, and this too shall pass. In the meantime, I will control the things that I can control so that I'm in the best mental and physical shape when normal life resumes. So you can see how that really prevents that all or nothing thinking, some of the irrational thinking about things will never be normal again, and presents your brain and presents yourself with something that's a little bit more balanced. Another example could be, I'm the only one who feels this way. No one understands my pain or loneliness and frustration. And you can convert that into something like, if I reach out for the support I need, I know I'll find people who understand me. So this is really called cognitive behavioral therapy, and it's really about challenging your negative automatic thoughts and making them more balanced.
So let's talk about social support. And in fact, when we were trying to find pictures for these slides, of course, when you think of social support, you think of hanging out together and having a glass of wine, or having tea together, or playing board games together, or, just watching a movie together. So the definition of social support is defined as trusting somebody enough to confide in them. And there's a tremendous amount of research looking at the dangers to your mental and physical health of having inadequate social support. And in fact, inadequate social support is as highly correlated to premature death as is cigarette smoking and high blood pressure. So not having people in your life is dangerous for your physical and psychological health. And it's really important at this time to try to maintain as many social connections as you can. So if you, for example, have been furloughed from work or laid off from work, and you don't have the normal catch up with everybody over coffee, reach out to them, have virtual coffee breaks, do virtual tea parties. I'm in a book club and we're now doing a virtual book club. We spend probably more time talking about how we're coping with a pandemic than we are the book, but it's just nice to have those connections with people. I've noticed personally, and I've noticed amongst a lot of my patients, and I've actually seen this now in the media, that a lot of people are reaching out to old friends. Like I've been hearing from people I went to high school with, and I'm old, so these are people I knew a long time ago, or relatives I haven't talked to in forever. So if they aren't reaching out to you, reach out to them. Reestablish those connections, because this is a really good time to catch up on the phone or via email or whatever. Reach out to friends, catch up with people.
And you can also go inward. Journaling can be an amazing way to also get your feelings out and to deal with your stress. Research really supports the efficacy of this. By writing down your thoughts and feelings, you can actually improve your health and decrease psychological symptoms. So sometimes it can even be more effective than talking to people. So if you're the type that's more introverted, or you tend to want to be more private about your feelings, that's also fine. We still want you to connect with other people right now. But if you want to keep your personal thoughts and feelings closer to home, you can just journal. And we really recommend, the research recommends 20 minutes daily for at least 4 days to improve your health and decrease psychological symptoms. It's not listed here, but I'll also add you can do a gratitude journal in addition to a feelings journal. And gratitude is one of the biggest sort of negativity shifters. So if you're feeling depressed or anxious and you write down into a journal or tell your partner, friend, family member 3 things that you're grateful for, it does tend to shift mood pretty quickly.
So this is probably my favorite, the concept of self-nurturance. And this is a lesson that's often really hard for those of us in healthcare, because most of us went into healthcare because we feel good about ourselves when we take care of other people. But it's really easy to just overextend yourself, and it's crucially important. And I think maybe sometimes, especially for women, because we're so uncomfortable taking care of ourselves, is you need to learn how to put your needs in an equivalent level to those around you. And, when I've been trying for many years to teach this to my female patients and my friends, they're always like, well, you're telling me to be selfish. And I'm like, no, there's a big difference. When you're selfish, you're taking care of yourself at the expense of other people. When you self-nurture, you're taking care of yourself in conjunction with taking care of other people. So it's almost like if you do a to-do list, and I actually had my patients do this, if, the number one thing is, deliver food to your elderly neighbor, number 2 needs to be something that's just for you. And the idea is about self-care. You're not hurting anybody by taking care of yourself. And in fact, there's been a lot of research that shows that if you aren't taking adequate care of yourself, the people around you suffer terribly. And so you need to recognize when you need to slow down. I mean, one of the things we talked about at the beginning were those stress warning signs, the physical signs, the psychological signs, the behavioral signs. And, you need to figure this out before you hit the wall. So if you start feeling irritable or sad or tearful, this is a time to stop and say, hey, I wonder if I just need to take better care of me, or I need to figure out how to tell people in my life that they need to take better care of me. So one of the things I love doing with patients is I have them write down the top 20 things in their life that bring them joy. And it's really fun, because when I do this in groups, we do it as a paired exercise. And so one patient will, be the scribe and write everything down while the other patient dictates. And it's like beautiful flowers and delicious chocolate and a ripe peach and travel and beaches at sunset. I mean, just the things that bring us joy. There's this incredible list. And I want you to write down the top 20. And whatever ones you can do now, do them. So you can still get yourself flowers. You can still eat your favorite foods. You can still light beautifully scented candles. You can take a mindful walk. I mean, this is the best time of year to take mindful walks. And you need to take care of yourself, because if you don't take care of yourself, you are not going to be the best daughter, sister, friend, partner, mother, aunt, nurse, doctor, whatever. We all need to take better care of ourselves.
So everyone reacts differently to stressful situations. There's a lot of variance between how people are going to react, and that's going to depend on people's backgrounds, what your job status is right now, what your own personality traits are, your upbringing, your living situation. I think the one universal theme right now is certainly that anyone going through a crisis like this, with this level of uncertainty and unpredictability, the normal reaction to that is to feel pretty worried and pretty stressed. And so just to validate that it's not just patients that are allowed to feel that way, everyone is feeling that way. I think it's just really important to be aware of your own triggers. If you've had loss in the past, even the loss of loved ones or people that you know who have been sick through the COVID experience or otherwise, it could trigger more grief right now and more loss and more helplessness. And it's important just to recognize that in yourself and get the help you need. This is a time for self-compassion. This is a time for patience. And I don't think that we are as good at giving that to ourselves as we are to our patients or our loved ones. So it's really a time to go inward and realize that what we're feeling is normal and that we need to support that.
So in summary, and I'm hoping there's some questions, and if you haven't thought of a question, do it now, please. Stress, which we're all experiencing right now, can lead to a lot of symptoms. And, you might have thought until today, oh yeah, the only way I know I'm stressed is if I can't sleep. Well, you know what? If you find yourself chewing a lot of gum, or you're just snapping at people, or you're craving potato chips, all of those can actually be symptoms of stress. It doesn't just have to be migraine headaches. You want to tune into your body, constantly check in. Hey, how am I feeling? Am I feeling physically okay? Am I feeling psychologically okay? Am I having any sort of funky behavior changes? Check in with yourself. And as we've gone over, there are lots and lots of physical and psychological methods which you can do to decrease stress. And, I'm always telling my patients, with all these mind, body, and relaxation strategies that we teach, it's really like a buffet. And, when you go to a buffet, the first time you go up, you try everything. And the next time you go up, what do? You pick the stuff you like. And so, Liz and I have just described, I think, 8 or 9 different ways to decrease stress. And so what you want to do is, try them all out. And there may be 2 or 3 that actually seem to work for you. And those are the ones you want to focus on.
Thank you so much. I'll go ahead and get started. We've had some questions that have come in. This is open to both of our presenters. When, in your opinion, can IVF cases begin again? Is there any date?
I think that's the $1 million question. I think that some centers have started opening up. I think it depends on what area people are in. I think it depends on whether they're connected to hospitals and academic settings. I think it depends on how hard hit the areas are that the centers exist in. I don't know that we have the answer to that.
Yeah, it's interesting. I just got an email this morning that clinics across Canada are starting to reopen this week. And I think there have been, as Liz said, some clinics in the U.S. that have been open all along. And, so for example, I work at Boston IVF, and the Department of Public Health had shut down all ambulatory surgical centers. And so we can't reopen until that's lifted and we can start, doing retrievals, et cetera. I'm guessing in most of the big cities, which have already been hit, that they'll probably follow the guidelines of the governors, and there have to be certain parameters that are met. But in some places, those have already been met. And I know all of us, I think that's probably why Liz and I have been so slammed lately, is, our patients sort of run on the anxious side anyway. And to then tell them, well, I'm sorry, we're shutting down, we can't cycle you for at least 2 or 3 more months, is making them frantic. And you'd expect the ones, for example, who are over 40 or who have high FSH or low AMH to be more anxious. But, I have to tell you, I've had some young patients be absolutely frantic. And what I've told all of them is, okay, let's assume you can't cycle for 2 months. What can you do in this 2-month period to get yourself as physically and psychologically healthy as you can get? So use this time. So when you can cycle, you're in a really good place.
And I just want to add that when people are back at work, you really need to take care of yourself too, which is why we really felt it was important to do this webinar, because the places that are reopening, we know that employees are feeling a tremendous amount of anxiety about commuting back to work, social distancing at work, being exposed to patients again. So it's not that all of a sudden the stress levels will go down as soon as people can go back to work. There's childcare issues with schools being shut down, but people having to go back into work. So just be mindful of everything we just went over as things progress, because stress levels will wax and wane through the next phase of this as well.
Thank you. The next question for both of you comes from a reproductive endocrinologist in the UK who is 82 years young. And it's more of a kind of a case-based question. There is a wife who is looking after COVID patients as an RN and as a manager and is currently under lots of stress and very, very irritable. This person does not have access to a psychologist or a psychiatrist. Do you both then believe, in your opinion, do you think that every health facility should have a clinical psychologist available?
You're asking the wrong people. Yeah, I mean, I think that, Liz and I are both in the fortunate position that we are what are called embedded mental health professionals. And so we are well, not right now, but we're usually physically on site to not only see patients, on a routine basis, but to be able to see emergent patients as well. I would hope that clinics that are too small and it doesn't make financial sense for them to have a mental health professional salaried or on site would certainly have a good referral system set up so that they'd be able to quickly get some support for that patient or for all patients.
Yeah, I mean, the mental health professional group of the American Society for Reproductive Medicine has a very strong and active membership. I haven't looked at the numbers recently, but well over 300, even probably 400 at this point. And most of those mental health professionals are consulting to clinics. They're in private practice. As Ali said, we are very fortunate and very lucky to be embedded in our programs at Cornell and at Boston IVF. But I don't think the majority are like that. And I know that if you looked at ESHRI, they have a very active nursing and mental health group as well that would probably be similar. So I think there are probably more resources than you may be aware of, and you can certainly back channel us, and we're happy to help facilitate contact with mental health professionals all across the UK and Europe as well.
I think it's really important for infertility patients to be seeing a mental health professional who's well-versed in REI. And I know that might sound elite or diva-like or whatever else, but I've had patients come to me and say that they went and saw a therapist who said, I'm a specialist in family therapy and women's health and infertility. And then the patient was talking about a recent cycle and said, I had really bad cramps after my IUI and it got me really upset. And the therapist said, what's an IUI? And, this might sound like a minor mistake to most people, but for our patient population, who tends to be very sophisticated when it comes to the medical aspects of infertility treatment, I think they need to believe their therapist understands the medical aspects. And also, I remember the first time when I got into the field and we were doing intakes for the Mind-Body program, and I was well-versed with infertility, and the person who was co-leading the group had never worked with infertility patients before. And he looked at all the psych screening questions, and he says, this group is way too depressed to be in a group. And I'm like, no, they are actually normal and typical infertility patients. They're having a very, very normal reaction to this really terrible life crisis.
Thank you. One viewer is wondering, are there any websites or apps that are also helpful to use? They know of Calm and Headspace, but they would like, are there any suggestions you can provide to share with patients?
You're asking the right people, because we happen to have co-authored 2 apps specifically for fertility patients. One is Calm and the other one is Strong. One is for women, one is for men, for the men and for the men to support their partners that are going through it. And they're both free as of now, and you can download them on the App Store. And that's very specific to coping strategies, some of the ones we went over today and other ones that are very much related to going through the fertility process. The more generic forms that were just mentioned, Calm and Headspace and Insight Timer and Mindfulness, there's so many good ones that also have mindfulness and relaxation techniques, FertiCalm and FertiStrong also have recordings on them. And we find that a lot of the doctors and nurses are using them to stay calm as well. So it's not just the patients. Allie, did you want to add anything to that?
No, I mean, I think that our patients have very unique situations that are unlike anything any other medical or psychological patient may face. And so for our patients, you know, being at a family event and having a little sister announce she's pregnant can send one of our patients under the covers for 3 days, and that is actually a pretty normal reaction to that. And so I think one of the benefits of the apps that are specific to infertility is that they actually talk about how to handle situations like that. You know, it's very normal if for one of our patients, if somebody else they know gets pregnant, they're going to have a really strong jealousy reaction, which often catches them off guard because they have never been jealous a day in their lives. And again, that's a pretty normal and healthy reaction to this. So I think what most mental health professionals try to do with our patients is to help them see how normal they are. And they might be depressed or anxious or jealous or in a rage or completely freaked out about being invited to a baby shower. But you know what? In our world, that's actually normal.
Thank you. Are there any suggestions for waking up in the middle of the night, say, with a racing mind?
Liz, you want to take it or do you want me to take it?
Sure. I mean,
Okay.
I'll start and then you can certainly add. Sleep hygiene is a big thing that we're talking about with both healthcare professionals and patients right now. Setting yourself up when you go to sleep is one of the best ways you can try to then stay asleep. Setting yourself up in a way where you're not watching the news right before you go to bed, where you're not having a disturbing conversation with someone you know that's going to be stressful, you know, dimming your lights, having a cup of tea, decaffeinated, of course, not having any caffeine anywhere close to bedtime, listening to soothing music, maybe reading a book, journaling, and getting your thoughts down on paper so you're not waking up with them in the middle of the night, listening to an app to go to bed so that you go to bed in a good frame of mind, and then having all those resources available to you in the middle of the night. So when you wake up and you are slammed with all those automatic thoughts we talked about, you can either listen to relaxation to fall back asleep, or you can journal. So that's sort of what I would recommend. What do you think, Allie?
Yeah, I mean, I think I would say it's probably the norm for people to now wake up in the middle of the night and feel anxious. I think this is a really anxiety-provoking time. And so there's a lot of do's and don'ts. You don't want to stay in bed more than 20 minutes. So if you wake up in the middle of the night and you can't fall back asleep, you know, what I would probably suggest doing is, maybe as opposed to counting sleep, is doing some of those mini relaxations, because mini relaxations may help calm you down and allow you to go back to sleep. If after 20 minutes, however, you aren't able to go back to sleep, you actually should get up and, you know, maybe sit in a chair somewhere. You do not want to use a phone or a tablet or watch TV, because that will keep you awake, but simply read a book until you get drowsy and then go back to sleep. In all honesty, your bed should be used for sleeping and sex. It should not be used for watching TV, being on your phone, your tablet, etc., watching the news, because you know, we get conditioned to get stirred up when we're in bed. And so if you can just use your bed for sleeping and sex, you're going to find yourself getting drowsy because your mind's going to associate your bed with sleeping.
And definitely don't watch the clock. Turn the clock around. Don't watch
the
clock. Yeah. And what I think one of the most important things Allie said was just acknowledging it's normal right now. Yeah. My friends tease me, my colleagues tease me that I have a superpower, which is my sleeping. No matter how anxious I get, I'm always able to sleep. And during the COVID, no one is sleeping. Like, everyone is waking up in the middle of the night. So I think it's just normal right now.
Thank you both. I think we have time for one more question. And the question is, what's the best approach in encouraging our coworkers and patients in practicing these principles to help cultivate a good work or clinic environment?
That's a big question.
Well, we love to do in-services. I know Allie does them too at Boston IVF. I mean, if you have the capacity to have a consultant come in, you know, we mentioned all the consulting psychologists, or you have someone embedded, or you just take one of the mindfulness apps and you play something during lunchtime for all your nurses or for the physicians. You know, what people are used to doing timeouts when they do a surgery. This is like a mental health timeout, which is equally as important. And so I think it's actually pretty easy to introduce into clinics to help with coworkers and to help with burnout and compassion fatigue. And it's actually critical because we know that people that are working in fertility centers, the burnout rate is incredibly high. They have research on this now, and we know that the turnover rate is really high. So it's critical to actually do this for our coworkers and for ourselves.
Yeah. And if you note, if you guys have all learned these strategies together, like Liz and I have both gone to clinics all over the world and to teach all these strategies, and I've heard reports afterwards that a nurse will be having a really bad day, and another nurse will go up to her and sort of put her arm around her and say, I think this is a good time to do a mini, or can I get you a cup of tea, or do you want to tell me about that patient? And I think there are ways to sort of integrate social support with more active forms of stress relief. I think I've been telling my patients for 6 weeks now may not be the time to thrive. You may not be your best self right now, and that's okay.
Thank you. Thank you to our panelists and attendees. You'll receive a survey by email after this session, and your feedback helps us give you the most relevant content. Your input is appreciated. This session was recorded and will be available on our website in the near future. Please join us for our next webinars on oncofertility in the time of COVID, scheduled for Wednesday, May 6th, and returning to work and preparing for a second wave, scheduled for Friday, May 8th, presented by the Association of Reproductive Managers. For any further questions or comments, please don't hesitate to contact us at webinars@asrm.org. This concludes our webinar.